In this video we're going to be looking at strengthening using the sit-to-stand trainer. Now, strengthening of the muscles that contribute to standing is often a goal in most therapy contexts. However, we're going to talk about how the sit-to-stand trainer can be used to create an environment where we can optimally try and strengthen those muscles. Usually strengthening gets done in practice of these muscles by doing squats at a wall bar or some sort of stationary device where the person can pull to standing. Now, a lot of very frail patients will be able to do 3, 4 or less repetitions before getting fatigued and needing to stop. And this isn't ideal in terms of strength training. So we know from strength training literature looking at athletes and healthy people that for strengthening muscles we want to be somewhere in the 10 to 12 repetition range. Now, a lot of weakened patients aren't going to be able to do that in a normal wall bar squat kind of environment. So the sit-to-stand trainer provides us with a platform where we can get to that number of repetitions that balances our priorities between muscle strengthening, but also a number of repetitions to practice that motor ability of standing. So I'm going to put on 20 pounds on the sit-to-stand trainer. And again, by offsetting a little bit of my body weight, I'm going to change the workload a little bit so that I'm actually able to complete, rather than struggling to finish 5 repetitions, I can actually complete 10 to 12 under my own power. So again, that offsets just enough of my body weight that I'm able to continue training past where I would normally fatigue. And so doing this for 2, 3 or even more sets of these repetitions can be a better avenue for strengthening than would just struggling to complete 5 repetitions and then collapsing and being fatigued. One of the other things that offsetting someone's weight by using the body weight support on the sit-to-stand does is it can smooth out the motion. So now I'm able to complete the whole motion under control. So I'm not pulling myself, trying to use momentum throughout the repetition and only working in certain parts of the range. Here I can smooth out the effort and really work on strengthening throughout the entire range of motion. So again, by using a little bit of body weight, even for those patients who are able to pull up to standing without it, we can actually gain access to more repetitions to be able to optimally strengthen, but also to develop the ability to do the sit-to-stand movement.